His question was to make sure there's no myocardial bridging. And the way we look at it is really to double oblique it and make sure that to the LAD. And let me just go back to MPR. So because these patients also, if there's a bridging, it would matter for like planning. So again, the way we train our trainees, always any question or anything on the CPR, go back to the axial and double oblique to really make sure if there's bridging. So you have to like really verify it here. So now we're gonna walk on the short axis here and see if the artery. So here there's a little bit some superficial diving. You see it here. So this is the LAD. It's very superficial. If we again, we double oblique it. You don't want to rely on this. This doesn't mean anything. You need to rely on the short axis here. So if I keep going here, keep coming here, now the artery is gone. So these are septal. So there was some dive in, but then the whole artery is we don't see it because there's no contrast filling. But verify on the short axis, the axial double oblique. Great point. So one of the ways sometime when we try to see if this patient did have some like, what do you call it, the like CTO or some fatty metaplasia. If this patient, they don't have the images here, I always go back to the non-contrast CT, understand the calciums, like non-contrast CT, and see if there's any fatty metaplasia that could like represent some old infarction. Another thing is, I'm not sure if it's saved here, but one of my settings when I go to the windowing, where is the window level? No, I wanted to show I had safe setting. I think it's really dramatic MVO like setting. Let me just try to come with it. Like it's very dramatic, like sometime you cannot see much, but I saved it on my settings, something similar to this. So this is one of the ways I look sometimes for like microvascular obstruction, translating from the MRI when you have like some area in the middle of the myocardium that doesn't have any reperfusion. And that does matter for the reperfusion. So this is one of the window, like kind of dramatic number I use like for the MVO. It doesn't look the best for the coronary arteries, and I don't see any MVO here. So let me go back again. So Dr. Winkler brought another point. When we look for the MVO, we try to use the thick MPR, maybe 6-8 millimeters. So this is like a quick way to assess if there is any infarction. And again, we don't have the CNA features here to assess the wall motion. We'll also assess for the wall motion. Don't forget the apical LAD, like territory. Sometimes there's like an apical aneurysm or some thrombus formation. Someone else, I think, had a question or it's addressed. Good question. So again, the same question is like, does this patient have myocardial bridging? And I remember this patient, when we were reading the CT, again, it goes back that we actually don't see the rest of the LAD. These are all collaterals. So again, anytime I really want to assess if there is an actual myocardial bridging, I go back to my axial images, find the lesion, and then from there, I will double oblique it and see it on the short axis, like proper short axis here, and then see if the LAD dives in. So let's follow the LAD together here. This is the LAD here, and if we follow it slowly, you will see some, this is more distal. Let me go more proximal. I think that was the question. Here, it looks like illusion, like it dived in, but I can argue these are more septal branches, and actually the LAD here, again, look at this branch here. I think this is still some septal collateral filling the LAD trying, but we don't see the actual LAD, so it's all gone. But if you have a question about the LAD, you have to verify the depth and the myocardial bridging here. Let's go back to the myocardial bridging. I think let's just practice how to measure the length and the depth together. I think that's really the second time we asked this question. So let's go back to the patient. I think it was Nadia. I think there is some bridging, let's say, in this segment here. I'm worried about it, so I go ahead and carry my cursor. You don't have to follow these, but one of the tricks, if you hold your Alt and with your mouse, you just go ahead and click on the segment that you're interested in. So hold your Alt and go ahead and click with the left mouse. It will take you with the crosshair exactly where you left it. From here, you just need to double oblique. So let's double oblique the LAD and try to see exactly how the bridging looks like. So now we're gonna go further and see how deep it goes in. So I'm just trying to understand how deep it is. So this is a good, like, area to measure. You see how it's deep here. This is a short axis, actual like short axis. So if you click on D for distance, and you can measure it and see exactly, I'm measuring about 3.5 millimeters. So that's for the depth. The length, the same thing. You try to double oblique it and show it on 2 long axes how much you have myocardial bridging. And the question sometimes comes like, how much to measure length? I try to kind of like see, I don't want to measure all the edges and what's so, but you need to kind of like find the best way to show the kind of like long axis. So if I go back and forth, sorry, the mouse is just like acting so slow. And if you go again, D, and you measure the distance, this is the beginning of the bridging. Sorry, this is the beginning of the bridging to the end of it. So I'm getting about 3 centimeter